So now it's time for our feature presentation, our panel discussion. And we've entitled this portion of the program, Ask the Experts. So tonight we have with us, and each one of these presenters have presented with us before over the past several months. We have Dr. Joy Peterson, we have Dr. Chan Hwang, and Dr. Ralph Peterson. They will be answering the questions that you have provided for them in the chat, as well as I know some of you may not have gotten a chance to put your questions in the chat or email me questions. So you can just voice your questions here tonight. So I will turn the program over to our experts. Welcome, everyone. So let's see. Can you guys see the questions in the chat?
Yes, we can.
So if you can see the questions, if you would just answer each one as they appear.
And so we would have to ask it first. Yeah, we need to repeat the question.
Okay. And as they appear, and if it's your area of expertise, if you would just answer them, please.
Okay.
Thank you so much.
Okay, you're welcome.
So it looks like we have multiple questions in the chat, and I think it may be helpful for you guys if we actually read those for you.
Yes.
Would that be helpful?
That would help, yes.
Sure. Our first question, I'll read this one and then we can turn it back over to Devi. When it comes to bone-on-bone pain, are there any alternative ways other than medication to help alleviate pain? So bone-on-bone pain, are there other alternative ways?
Yeah, there hydrotherapy.
I think is Dr. Hwang here?
Yes, I'm here.
Hi, welcome. I think that might be a question for you.
Thanks.
When you have major surgery and opioids are provided for pain, should you not use them? Or are there better opioids to take that are less addictive for pain? Very good question. This is probably something that you and your doctor need to discuss. Most surgeons are more than willing to give you non-addictive alternatives. But it's something that you really need to discuss with your surgeon. And I don't perceive it as my role to tell you not to take something that you and your physician have discussed previously and your physician has prescribed. In other words, I don't think it's appropriate for me to tell you, oh, your doctor gave you opioids, don't take them. Does that make sense? In other words, I don't want to get in between you and your treating doctor. Most doctors, in fact, I'm pretty sure any reasonable doctor would be more than happy to give you medications that are not as addictive or not as dangerous as opioids. There are studies that show that certain non-steroidals, for example, are just as good for post-surgical pain as morphine. So that's something that you and your doctor should discuss in advance of your major surgery. But excellent question. Thank you for asking that.
So it should only be taken after surgery.
Sure. Could you repeat that, please?
So it should only be taken after surgery?
Oh, so in other words, the question was, opioids are given after surgery, and the question is whether you should take them or not. So if it's something that you and your doctor have discussed, and hopefully it was prior to them prescribing, You know, it's not my place to tell you whether to take them or not. This is you have your doctor knows you much better than I do. They did surgery on you. And if they believe that you need certain types of medications to control your pain, that's something between you and your doctor. Does that make sense? But yeah, certainly after surgery, use of opioids is warranted in many cases. But as I mentioned before, there are medications that there are studies that show that non-opioid medications can be just as effective for certain post-surgical pain.
Oh,
I hope that answered your question.
yeah.
Oh, good. Thank you.
Okay, thank you, Dr. Hwang. Our next question is, how do you determine which supplements to take when you become vegetarian or vegan? I think that question is directed to Dr. Joy.
Thank you. Normally, we don't push supplements. We prefer people to follow a diet plan. And so I have a My Plate vegetarian, vegan, My Plate diet plan. If we follow the diet plan that we have here, where it talks about eating your grains, your protein foods, your vegetables, your fruits, and then on the outside has that little circle there for your calcium, we will get all of the nutrition that we need. However, sometimes we may tend to eat more from one group than another. And then, of course, that's where supplements would be helpful. So we don't always recommend supplements. Some cases, especially when we're talking about vegan, the word B12, which is vitamin B12, may come up as a question because B12 is found only in the animal products. However, if individuals are eating foods that are fortified with vitamin B12, like your soy milks and all of these other types of foods, then that can take care of the B12 issue. If you're not so sure, a B12 vitamin B complex would take care of it. But it's always good to go and get checked out by your physician. And of course, once you do those testing to find out how your cholesterol and other areas of your body, how that's working, then they can say, oh, you may be low in calcium, so you need to take more calcium. And they may recommend taking calcium supplements if you're not, taking in the foods that are rich in calcium. So supplements are a backup, but it's not the definite way to go. Once you follow this guide that gives you grains, protein foods, fruits, vegetables, and of course your calcium rich foods. Hopefully that helps to answer the question. And I just happen to have my vegan My Plate guide for you.
Where can we access that?
And this one, this is a vegetarian resource group, but we can, I can get it scanned and sent to you by email. And so then it can be passed out as a link.
Thank you so much.
For the B12, calcium, and some other nutrition tips. So that's vegan My Plate.
Vegan My Plate. Thank you.
Yes.
Did that answer your question?
Yes.
Good. Dr. Peterson, I'm looking at the questions and it looks like there's another one that's related to nutrition.
Okay.
And it appears that, okay, then we have another question related to nutrition too. But it appears like the majority of the questions are related to opioids and their effects and addiction. So
Okay.
let's see here.
It was a bone on bone question. I don't know if it might be.
Yeah, I think Dr. Hwang
Okay,
answered that
Yeah, he
one?
talked about
yes,
that,
that's
yeah.
right.
Mhm.
So the other question that I see is, do we really need probiotics, or is good nutrition enough?
Yes, I'll have my husband do that and we can both go back and forth, yeah.
Good evening.
Good evening.
Many of the foods that we take in can be probiotics. I don't know how many of you eat legumes or beans or peas or even nuts for that matter. But earlier, just a few minutes earlier, we heard a presentation talking about the biome. And the prebiotics are very, very important because the prebiotics work in the gastrointestinal tract, and they are very helpful in promoting probiotics and helping the gut to produce the bacteria that's necessary to keep the gut healthy. And so, yes, we do need probiotics and even prebiotics, and we can take both in through our foods. So it's one thing you want to keep in mind. One of the most common probiotics is actually beans or peas or legumes, as I mentioned. And they in turn, once they get into the gastrointestinal tract and help promote, by interacting with bacteria, can actually help promote development of probiotics and help promote the health of the biome inside the gut. So they are both important. Yes, they are both important, very important.
And we just want to add to that, some may use dairy products to help them, like yogurt. And because of that, the bacteria processing that takes to form yogurt can be helpful in the dealing with the gut.
I hope that answers your
Yes.
question, at least partially answered it anyway.
Yes, yes, it does. Thank you.
Okay. We have another question. Is there a difference between developing a tolerance to opioids, for example, needing higher doses to relieve pain related to an injury versus becoming drug addicted? And are there early warning signs to help a person tell the difference?
Excellent question. For some reason, my
He has a bad internet connection.
Oh,
Yeah, I think that's what he was trying to say, because I saw that message come across, so we may have to move to another. Well, most of those questions are opioid related, as you said.
and Dr. Peterson can also jump in as well.
Yes.
Well,
I don't-
as we wait for Dr. Hwang, I'll just add a few things.
Yeah.
There are several things we need to understand is that you can develop a tolerance to almost anything, not just opioids. The more frequently you take a substance, particularly a biochemical substance within the body, you become, the body makes some adjustments to it. And oftentimes the body works in a way that you have to, if it's actually working in the limbic system and this part of the brain that actually deals with the addiction process, the more you take in and the more frequently you take in, the more you have to take in higher doses. There is a difference between just tolerance and also addiction. Addiction is when you get to the point where your body feels like it can't function without taking those substances in. And you have to keep taking, tolerance says that you have to, for instance, most physicians order pain medications actually, because they realize the danger of addiction itself, will give it to you in small doses or controlled doses. But what happens when a person becomes addicted is they tend to increase those doses on their own, usually without permission of the physician, or even if the physician may be unaware of it. And they have to keep taking it over and over and over. When you become addicted to it, what happens is that the person actually feels like he or she cannot survive without it. They can't go on without it. They must have it at any cost. I'll give you a good example of that. One of the best examples, the most common examples I think most people can identify with, even if they're not on opioids, is tobacco use. People become addicted to nicotine and you've seen people who become chain smokers. And one of the things that a chain smoker will do, a person which is a good example of addiction, is that once they smoke a cigarette and they've become addicted to tobacco, they have to have it more frequently and they have to have it in higher doses. And so what happens is that, for instance, if a person is addicted to tobacco, they may, when they get to every 15 to 20 to 30 minutes, they have to have a cigarette. They have to have a draw, so to speak, and a shot of nicotine in their system. A similar kind of thing actually happens when you're on opioids. Probably not to the degree you see it in tobacco addiction, but it does happen. And I think you have to kind of remember too is that opioids are quite different from tobacco, but there's a similarity in the way the two addicting substances work. Most people also realize that in addiction, when it comes to a tolerance, you can tolerate something and without being addicted to it. Okay, you don't have to be. Addiction is going beyond just tolerance. Addiction is complete dependence upon that drug. It's like you just can't not do without that substance. And of course, I just gave you an example of that, talking about a person who's a chain smoker and who uses tobacco. That actually happens. A similar kind of thing happens in alcohol. This is a possibility. That possibility occurs also with almost any chemical or biochemical substances. In fact, you can even have a similar kind of situation that even deals with food, certain foods. Some people are addicted to certain foods, certain behaviors, exactly, is an addiction process. And the more you experience that behavior and get a euphoria from it or a high, the more frequently you want, the brain taps into that. The dopamine gets released and you get a high from that. And the body remember we talked about this in one of the presentations, is that the body has, we talk about neuroplasticity, and the body has the ability to remember and reinforce the experiences that it's had, but it also can unlearn those experiences also. And that also is a form of neuroplasticity. But this is where we're talking about addiction is that, and tolerance. Tolerance means that you get to a point where some people, for instance, with alcohol, for instance, or even with the tobacco, they take it and it doesn't seem to have any effects upon them. And then there are other people who take a drug or alcohol or cigarette, and it has an immediate effect upon them. That person is not addicted, but the person who haven't even developed the tolerance. But if they feel like they continue to have it, they have reached a point where they're not only tolerant, but they are addicted, and they feel like the body cannot go physiologically, psychologically, maybe even emotionally as well. They have a difficult time dealing without having that substance. I hope that helps to give you some insight into that.
This is Lionel. I had a follow-up kind of question, very similar to what you just said, but so we know that opioids can be addictive. And so, somebody who doesn't want to take those, but needs to take an alternate pain medicine, like Dr. Hwang was talking about, some of the non-opioid pain medications also addictive, and I think you kind of answered that, but I'm not sure.
Most of the non-steroidal medications are not addictive. They don't seem to have that effect, but they can have some side effects. For instance, let me give you a case in point. I have a dear friend who used to work in the medical office with me, who was a medical assistant, and this person was having problems with just frequently having headaches. And they were taking non-steroidal analgesics for the headache. And I'll give you a good example of that. Excedrin, for instance, constantly taking it whenever they had a headache, and they took it frequently. And one of the things you have to keep in mind is that some of these medications are not addicting necessarily, like some of the non-steroidal medications, but they do have side effects. All medications have side effects. And one of the things this person actually experienced is the fact that that person had liver damage from taking these non-steroidal medications over a period of years. And they were taking them frequently, and the more frequently they took them, the worse the situation got, to the point where they actually had to have a liver transplant. So sometimes sometimes even not taking opioids or something that's addicting can be just as detrimental to your health as a steroid. So you have to be very careful. But I had a privilege a couple of weeks ago of talking to a dear friend of mine who's actually a neurosurgeon. And one of his areas of specialty is dealing with pain. And he was sharing with me some of the new concepts and things that are coming along. In fact, some of those he's worked with himself is that there's some modalities that are now being used where they don't even have to use medication at all to treat pain. And so that has to be, you have to talk to your physician about that. And Dr. Hwang talked about this earlier. Most physicians will do whatever is necessary to try to help alleviate your situation. They're there to support you and to encourage you. And so therefore, they know you better than someone else does. And even so what happens is they will discuss this. They will give you the various different views. Usually there's more than one way to treat a problem, whether it's pain or some other problem you're dealing with. And so they will give you all the scope, tell you what the pros and cons are. And oftentimes they will let you participate in making a decision as what you feel is best suited for your purpose, because they don't want you to have to go through the difficulty of having addictions or like opioids or whatever. And he shared with me some very important things. Then again, I have a friend, personal friend, who is a physical therapist. Now, I don't know how much you know about physical therapists, but physical therapists also work with individuals who have pain. And they don't prescribe drugs, for instance. They use hydrotherapy, they use some other modalities that are very, very important in helping to alleviate pain. For instance, you talked about the bone-on-bone pain, okay? Physical therapists can help you work around that situation to help alleviate the pain. It's different and it takes more time, but it's a possibility it can help you to develop a modality that's suitable for you in your personal situation so that you don't even have to take medication at all. So I hope that answers some of your questions.
Yes, thank you.
Can taking too much opioids lead to commit or attempting to commit suicide?
Well, one of the, thank you for asking that question. One of the effects of opioid medications is that it does have a central nervous system depressant effect. In other words, it can decrease the function of your brain. And there are people who, because of opioid related complications, do end up committing suicide. Good question. Thank you for asking that.
I just had
Sometimes it's actually accidental.
Most people don't want this.
Yeah, that's true. I mean, sometimes it's accidental. For instance, I don't know if you know Heath Ledger. He's an actor.
Yes.
He was taking prescribed doses of opioids and the prescribed doses of a sedative. The only problem was he happened to take a drink with it too, with alcohol.
Alcohol.
And so instead of adding these CNS depressant effects, alcohol, opioids, and the sedatives, they
don't
it's
mix.
like multiplying it. And so this man actually killed himself by drinking and using opioids and sedatives together. And that happens very frequently in real life. You don't hear about it on the news unless it's a big guy like people know,
Heath Ledger.
like Heath Ledger or Marilyn Monroe. But
Yeah.
people do die this way very frequently, unfortunately. And in his case, it was accidental. It was ruled an accidental
Oh.
death, but sometimes people do it.
Wow.
They may feel depressed, and then
Yeah.
they drink, and then they also take their pain medications.
Yeah.
And when they did the blood analysis, he wasn't taking any more than what was prescribed.
Oh, wow.
You're not supposed to drink with it, and that was his
Oh.
problem. He
So he
drank,
didn't know
and he
that?
took his actual prescribed dose, apparently.
It tells them, yeah.
Yeah. Does that answer your question, sir? Excellent question. I'm so glad you asked that question.
Yes, that's a good question.
It does answer the question.
I have a question.
Yes.
Thank you.
All right. Yeah, I have somebody who told me that opioid is added to most of medications that we have. Is that true or it's not true?
That's not actually.
Yeah,
I mean, there are many medicines without any opioids in it.
Yeah.
There are combination opioid with Tylenol. That's a very frequent combination. But in terms of pharmaceutically available medications, no, it's not true that they don't add opioids.
No, they don't.
That would be criminal.
Yeah.
If it happened, it would be bordering on criminal negligence. That's something that doesn't happen. But that's a good question. I'm glad you asked that question. Did that answer your question, Enoch?
Yes. Yes.
Oh,
Thank
good.
you.
You're welcome.
I have another question. I think this is going to be a very interesting question for the doctors to answer, especially when we're dealing with some of our teenagers and young adults. The question is, now that marijuana is legalized, how can we encourage people to not use it, especially when they experience benefits from its use? Benefits such as from pain, depression, and anxiety, primarily with youth and young adults.
That's a terrific question, DV.
Yes, Shadena asked that one.
Very good, Shadane.
That's a good one.
Yes, in my state, Washington, marijuana is legal. Now there are two major forms of the substances in marijuana, and the first is tetrahydrocannabinol, THC. Now this is the addictive part of marijuana. Then you also have various other cannabinoids, such as cannabidiol or CBD.
Yes,
And CBD is not addictive. However, the pain relief comes from CBD and not THC.
Yeah.
And so I think it would be very useful if they can isolate. And in the state of Washington, there are CBD preparations which help with the pain, but they don't make the person addicted to it. So if they're able to isolate the CBD, such as, for instance, in Washington State, I don't see a problem with that because it doesn't make them addicted, and it doesn't cause the maladaptive behaviors that come along with addiction. That can sometimes happen, as Dr. Peterson was talking about.
Thank you.
So,
You're
okay. Good.
Sorry, DB.
That's okay.
Now, in states where it's not legal, you can't. I don't believe you can get this even.
No, you cannot. You can go to jail.
Right, you go to jail.
Okay, there is a, someone texted me a nutrition question. Hold on 1 minute. And that is, how much does diet play a role in opioid addiction, or how can diet help with opioid addiction? I guess that would be for Dr. Joy.
Oh, and Dr. Ralph, we both he covers nutrition. He's the expert in the opioid, but
Oh, I'm not an expert.
yeah, so for information, so what, can you give us an answer to help with that?
Let me suggest a couple of things.
Yes, because it's,
One of the ways that diet is extremely important. Everybody has to eat. And what we do know about the brain and about the body is that about 70 to 80% of our immune system is located in the gut, digestive tract, particularly around the stomach area. And we know that also that there are certain foods as well that actually have a very soothing effect upon the brain. There are also some foods that also reduce, almost eliminate inflammation, which is where pain actually begins. And some of those foods can actually reduce the need for certain medications like opioids. The problem is that many of them are not prominently known in the public. In fact, some of them are eaten on a regular basis, and many people don't realize how important they are, and the fact that they are very, very beneficial. Let me give you a case in point. Cabbage.
yeah,
Now, many people think about cabbage. First thing I think about is I think of coleslaw. But there are some substances actually what we call chemicals, nutrichemicals that actually reduce inflammation from pain and also are capable of reducing the need for certain medications. So I think nutrition is extremely important, but it's important that people understand how to use these particular foods or even substances. Let me give you another case in point. Turmeric.
right.
Turmeric is a spice that's been used for centuries in different parts of Asia, Middle East, for centuries, and even in some parts of Europe. It is an anti-inflammatory substance, and it is extremely beneficial not only to pain, but it has a very beneficial effect on function and cognition and functioning of the brain.
Right.
So I think one of the problems we have in our society is that we don't seem to promote those things that are more common and that are very easily accessible to most people and very inexpensive. But I think a lot has to do with the knowledge of the person that is taking it and also the one that is prescribing it as well. Important, but nutrition plays a very key part in helping individuals not to have to take certain medications or even drugs for that matter.
And ginger is also another one.
There are a number of them.
Yeah.
There are a number of them. We
Ginger.
can give you lists of them. As a
Yeah.
matter of fact, we can send you a list of it,
Yeah.
of a number of foods that are anti-inflammatory, that are both beneficial for pain, reducing pain, or even eliminating pain or controlling pain, as well as they are beneficial to the cognitions, brain cognition. So, I think it's very, very important to understand that nutrition is very, very important. It's one of the 8 basic natural laws. Did you want to say some more?
Yes, we would like that list. If you could send that list too.
Yeah, sure.
Okay, so we will have that on the vegan nightly.
Thank you.
Mhm.
Does that answer your question? I hope that answers the question. Okay, let's see.
Yes.
Yes, the person said yes, that answered the question. Thank you.
Yeah, you're welcome.
Let's see. Let's ask this. Let's see. Hold on. Besides risk for addiction, what are the long-term side effects of using opioids over a long period of time?
That's a very good question.
He runs, right, the doctor.
Well, I can think of a few just off the top of my head. One of the things it causes are psychological issues.
Mm.
We talked about depression, for instance.
Mm-hmm.
Erectile dysfunction in men,
Oh, wow.
common with opioid, long-term opioid use. And it has to do with the interactions between the opioids and the hormones. It causes decreased immune function.
Mm-hmm. Respiratory depression.
Yes, respiratory depression, of course, is the one that kills most people
Oh.
with opioid issues. Constipation.
Oh yeah, that's true. It
Problem.
does. Mm-hmm.
Yeah.
We'll need a high
Suppression of appetite.
Oh, yes,
We'll need a high fiber diet. Oh, okay.
absolutely. Can you think
Okay.
of any others, Dr. Peterson?
I could think of a number of others. I think you mentioned some, Dr. Hwang, and one of the ones that I think that I found in my personal experience in dealing with people who are addicted is cognition.
Oh, absolutely.
It really affects cognition because what happens with opioid addiction is that it actually hijacks the brain, similar to what actually happens in a person who's on alcohol or tobacco. And the person has difficulty making good decisions. And because they're focused on soothing, or I don't even know if I should even use the word soothing, but relieving or that urge for this medication. And the other thing too is what it does to the body. Almost all drugs have to go through the liver. And eventually, if you take any drug over a period of time, it actually has some very negative effects upon the systems of the body, in particular the liver, because the liver is one of the major organ systems in the body. Everything goes through there. And many of the systems that the liver has to deliver are affected when you're taking on a substance that interferes with their normal functioning. So there's a long list of things we could actually go through, but trying not to get in too detailed in terms of physiology, but that is extremely important to me. But cognition is extremely important because it affects the way a person thinks and their objectives, the focus. All those things are very affected by opioids.
Yes, opioids, as you mentioned, Dr. Peterson, will take away the most important organ you have to fight not only pain, but all the other problems that come with it. And that's the brain. It is really rough on the brain.
Yep.
I hope that answers the question.
It does. Thank you.
Oh, you're welcome.
Okay, we have about 15 minutes. There are 2 questions from 2 different community members that I think I can combine because I believe that they're similar. And it is it easier or harder to break a drug or opioid addiction when it is hereditary versus a formed habit? And the other question is, what's a good way to educate individuals on the role of genetics in addiction as a preventive measure?
Loaded question. Stevie, that's a loaded question.
Not mine, thank you.
No, it's not a bad question. It's actually a good question, but I don't think it could be answered in one session.
I know, it's probably a deep question.
Don't know if any of you had the experience of seeing a child is born to an addicted parent addicted to drugs. I have had that privilege. It's not a very pleasant one. And one of the things we talked about earlier in the presentations is the fact that opioids actually cause structural and physical damage to the central nervous system. It affects the neurons, affects the synaptic cleft, affects all the areas of the nervous system. And a person's normal responses, physiological and biochemical functionings, are very severely affected in a child if they're born to a person who is addicted to heroin or cocaine or any of the addictive substances or opioids or any other kind of addictive substances, period. And so that is a very, very difficult thing. One of the most important things to do is that if a woman realizes that she is pregnant or expecting, one of the first things we tell her immediately is to come off of all things that will harm her, whether it's tobacco or alcohol or even medications she shouldn't be taking. She should make sure she get them approved by her doctor, because they can affect the child in its development, its fetal development. And education there is no price that you can pay for education. Education is extremely important. This is why it's important for a woman is as soon as she finds out she's pregnant, she needs to make sure, okay? And her lifestyle and what she's doing, the food she's eating, the way she lives. In fact, we put her on a maternal prenatal medication, and someone asked a question earlier about supplements. This is one of the times we do put her on a supplement, because we want to make sure she's getting adequate amounts of the B complex vitamins, which are very important in the development of the nervous system. We talk about B6. So among the other B vitamins as well, all the B vitamins really, folic acid, all of those are very, very important. So education is extremely important there. And it is very important that a young lady or mother, whatever her age is, that she gets on a medication or a supplement, I should say, not a medication necessarily. I don't consider nutritional supplements medication necessarily. Most of the times you give them to make sure that the person is getting sufficient amounts of them, B complex vitamins and also iron and a few other substances, because she's now eating for herself, but she's also eating for the development of her fetus. So, but I think it's very, very important to train or to educate that mother so that she understands the importance of the life that she lives and the things that she does is going to affect her offspring. Not just now, and not even just after the child is born, but for the rest of life, they're affected. And since the structural, physiological, and structural damages and changes that take place in the brain during the developmental process, those developmental processes are never corrected during the life of that individual if it's a child born to a mother who has been addicted to opioids. So those are kind of considerations I think they're extremely important. We could actually go on and talk about this for long periods of time, but there's a whole lot of information involved here, and a lot of research has gone into this. I hope that it probably doesn't answer all of your questions, but I hope it helps.
It definitely does help. Thank you.
I see a question in the chat. It's a very good question. And this is from Charles Johnson. He asks, what is the best way to help someone close to you, family member perhaps, with an opioid or drug addiction without enabling them or causing a codependent relationship?
That's extremely important.
Very important question.
Mm-hmm.
Sometimes you can talk to your blue in the face, but if you're talking to someone who's dealing with an addiction, it might seem like you're talking to the wall for all the good it seems to do.
Mm-hmm.
And the best thing for them, obviously, is to get treatment. There are treatment programs for people with opioid addiction. And sometimes it takes divine intervention before they realize they need help.
Mhm.
And as the saying goes, you can lead a horse to water, but you can't make them drink. And sometimes, despite all your best efforts, nothing may seem to change. But what I would say for someone like this is to pray for them, because
Right.
when you try to work things out, sometimes things can get even worse. But when you pray, you are divine intervention. You're giving permission for God to work in their lives, and I would say that that is probably the best thing to do for somebody. Sometimes, no matter what you talk to them and say to them, they won't listen. So, but if you pray for them, God will do. He will move mountains when you pray earnestly for a person.
I have to agree with Dr. Wong.
Yes.
Sometimes the closer you are to an individual who has that situation, the more difficult it is to work with them, because they see it as a rebuke from you, as a form of rejection. And I think we talked about this in one of our sessions. The fact is, we have to be careful by the words we choose to use in talking or addressing to that individual or individuals, because they see it as a rebuke oftentimes, rather than extending a hand to help them or to encourage them, to uplift them. And so, but one of the things we have to do is be very patient with those individuals. And I think that Dr. Wong hit the nail on the head. The best thing to do is to pray and ask God for wisdom, because, you know, people take advice from different people in different ways. And in my experience, the closer you are to that individual, if you have a relationship or association with them, sometimes the more difficult it is for them to take advice from you or even accept your help and assistance. But we talked about this before too, about being kind, loving,
And non-judgmental.
yeah,
Yes.
and trying to, but still ask for wisdom from God, because He knows that person better than you or I do, and He can help them. He can change minds. And as Dr. Wong said, when we pray for them, it gives God permission to intervene. Even if they don't ask for permission, but because you have a concern, God will answer your prayer, and He will work with those individuals. And it may take years and time. Sometimes it seems like it never changes anything, but I think to me, that's the best approach.
And you don't give up.
Yeah, you don't give up on them. Don't give up on them. You know, that's just keep working with them as best you can, as God permits and as they will allow you to.
Can I add to this?
Sure.
I would also like to just give a testimony, kind of, sort of. I had a family member who had some struggles with drugs and so forth. And that was my approach. I prayed for that person intently, like in an intense way. And this person got incarcerated twice. And it really helped this person. And you know, a lot of people couldn't understand the joy I felt with this person being incarcerated. You know, from their standpoint, they saw it as like, oh my gosh, you know, they're separated from family and society and so forth. And I saw it as God intervening to help save that person's life. So definitely prayer can be a powerful tool in helping with that, but definitely kindness, being non-judgmental, just loving them, not that hardcore love, like not that tough love that can send them over the edge,
Yes.
They're labeling them as well, so. Thank you.
Thank you for sharing, Shadana. We have two raised hands, two final comments, Lionel and then John. Lionel?
So not to negate everything everybody said, I understand that, you know, we need to be patient and we need to pray and be gentle. But I have a question from somebody who's had somebody addicted, family member addicted for a very, very long time. Is there a way, if you get tired of the gentle approach, is there a way to kind of almost legally force somebody to go to a rehab? Maybe if they don't want to go or they've been addicted for a while and they feel like they're not in that direction. Is there any kind of way to kind of force them to go to rehab?
I don't believe that you can legally force them to go to rehab. If that person has reached a point in his or her life that they become a danger to society and not just to themselves, you may be able to use some kind of a legal recourse to help them go and get help. But if that's not the case, if they also may have be considered a mental problem where a psychiatrist or psychologist or clinical clinician suggests that they are a danger to themselves and to others, potentially suicidal or something like that, you may be able to get some legal help or support that way. But I don't think there's any other way that I'm aware of in most states where you can force a person to go and get help if they don't want to.
However, if they are minor. then
No, it's a different thing if the individual's a minor,
yes.
but if they're an adult,
Yeah.
you know, that's different.
That's your question, Lionel?
Yes, thank you so much.
All right, no problem. John, you have a question or comment?
Okay, a while back, you mentioned something about depression, and someone who was depressed was addicted, had become addicted to opioids.
Yes.
But I suffer from depression, major depression. My question is, what does that mean that I would be addicted to opioids? What about
Synthesize it.
chances of becoming addicted to opioids?
Generally, I think opioids are prescribed for people with depression. Generally, just briefly, John, generally, I don't believe that opioids are necessarily prescribed to individuals who suffer from major depression. As you may know, the World Health Organization has described depression as the major health problem, mental health problem in the world. There are more people worldwide who suffer from depression than we can even begin to imagine. But no, the best thing I would suggest is that not opioids, but there are medications that are given to individuals who do suffer from depression. And my first recommendation to you would be to see a clinician, a clinical psychologist or a psychiatrist who can actually help you with your problem, because there's more than one way of working with a person who has depression without actually even using drugs. So that's one of the processes you want to look, and a clinician would be able to help you with that, and even treat you through psychotherapy. So I think if I were you, I would try to get some help that way rather than going the way of opioids, because opioids are not necessarily prescribed for that purpose. Now, people may actually take opioids and suffer from depression because that's one of the side effects of taking opioids for any period of time. But I would not suggest that most clinicians would not give you opioids. If they figure you have a depression problem, they would be very careful about giving you opioids. They would try to find another way of treating you, even if it's for pain.
Oh, okay, that's good. That's a load off my mind.
All right, so that answers your question, John.
That's good.
Very good, very good. Well, we want to thank our panelists tonight, our experts tonight, Doctors Joy and Ralph Peterson and Dr. Hwang. It was an excellent presentation tonight. We thank you for fielding all of the questions off of the cuff. You didn't have any prior knowledge, but you answered the questions in depth and made them very relevant. For that, we are thankful. And we thank you for being facilitators throughout these several months that we've been going on with the project. So we say thank you. Thank you everyone for your questions. You asked some very in-depth questions, and I thank you for your participation as well.